EHDI and Part C. So we've got two different views there, and I think that it'll be great. So we're going to move through a bunch of information, and so we're going to ask you in the beginning to use your chat and put your name and your program and your state in the chat for us now, so that we can sort of also see where we are and who's with us today, and everybody can see that for each other. And then as you're thinking about things, put things into the chat, and we'll get to the chat questions, and then at the end we'll have some time for discussion and doing that.
And Heidi, one thing, folks, when you're entering chat, if you want everyone to be able to see it, you just need to select where it says "to." Just change that to all panelists and attendees so that everyone can say hello and see who you are.
Thank you. And we have some polling questions. So Kellen, you want to bring them up?
Oops.
Oh, so first we have the outcomes. So our outcomes for today are that as participants, you will gain an increased understanding of the requirements related to the data sharing under IDA and FERPA, and that you'll gain knowledge of the data sharing arrangements from 2 states, like I just said, including some of their challenges and strategies, and that you'll become aware of some resources related to data sharing. So Kellen's going to bring up our first polling, both the polling questions. And so if you could just take a moment to answer these.
I think people might still be typing their introductions. We have just a few votes so far. Here we go. So about a quarter of people have responded. Almost half. Maybe another 20 seconds or so. Still a few people responding. All right, we might have leveled out right at 50, Heidi.
Okay, so let's share the results. Okay, so please select an option that represents you. So we've got about 31% who share multiple data elements across C and EHDI. We have 40% or 14 folks who share limited data elements across C and EHDI. We have 7 or 20% who have begun discussing but do not yet share any data, and 3 people who did other, and we can see what that will be in a minute. We also asked you to select one option regarding your current data sharing activities between C and EHDI. So 17% or 6 of you said that you had a FERPA data sharing agreement. 11 or 31% said that you don't have an agreement, but you have an interagency procedures for data sharing. And then 10 or 29% said that you only share data individually with parent consent. And then 8 had other. So do we have anything in those chat boxes so we can see what the other looks like, Colin? Or
yeah,
that would be over here.
Yeah, we do, Heidi. And we certainly want to remember to copy everything in the chat box so we can collect all that later.
Sure. So it looks like there are some MOUs or MOAs, and that looks like the most common other way that is going on. Okay. All right. So I'm going to turn it over to Sharon now.
Thanks, Heidi. We know that a conversation on the IDEA and FERPA requirements related to data sharing would take us several hours. So we've tagged this 10-minute segment of our time together as brief reminders, and it will be just that. We've got about 5 slides. We know that it's important, and we know you all recognize that, to cover discussions around IDEA and FERPA. And for many of you, you also need to include some HIPAA conversations, depending upon what agency you are and the status of HIPAA in your data sharing. So remember that if for HIPAA, you want to make sure you're always touching base with your privacy officer. But let's go through a couple of the slides and talk about some brief reminders about IDEA and FERPA. Consider, just for purposes of this conversation, 2 different scenarios, and we're so pleased that Arizona and Georgia have agreed to share with you today, because scenario A is a good example of one of them and B of the other. The first scenario would be if you're a single lead agency, and we know over 20 of the states in Part C have health as their lead agency, which means that for you all, usually EHDI and Part C will be in the same department. Often you're in the same bureau or branch. Sometimes you're sitting next to each other, we know, but you most frequently also have 2 different data systems. So that kind of is scenario A, and you have to consider certain things when you make your arrangements when you're in that scenario. B would be for those states that are not, where Part C is not in a health department. So in this example, you can see where you've got 2 different agencies and 2 different data systems. And this is a good example where you really need to pay very careful attention, even more so than what is required for you under IDEA and FERPA. And you'll hear more about that when the Arizona folks share their story with you. So a couple of brief reminders. It's always safest, and I'm channeling and echoing someone we all know well, the former director of the PTAC Center, Baron Rodriguez, who always said that obtaining written parental consent is really the safest way to share data. And we know why that doesn't give you what you need when you're talking about evaluating your program like we will on this call, but you know you're safest when you follow IDEA and FERPA requirements around getting written informed parental consent. But if you're sharing aggregate data and you're not releasing or including any personally identifiable information, you do not need to worry about consent at all. So if you produce a report and your ends are high enough that talk about the % of children who were referred to Part C or referred from EHDI to Part C who ended up being eligible, and you have no personal identifiable information in there, you're not worrying about your consent or your data sharing. But often that report that I just described is the result of a good data sharing agreement where you were able to share data and produce a report that allows you to evaluate the progress that you're making both in your EHDI and your Part C program. You have 2 sets of regulations that exist there, and a lot of this I'm sure you know and work with every day, but reminders. Part C, you must follow the regulations at Part 303 in Volume 34, and there's specific requirements, as you know, on consent and confidentiality. Part C refers directly and incorporates by reference the FERPA regulations, Family Education Rights and Privacy Act. And again, we can't cover the details on all of them, but what FERPA gives us is if you're looking for exceptions to getting consent from every single individual child, you have what are called exceptions in FERPA. And we've got a slide coming up in a minute. We can describe what those are, but that's primarily the way Arizona, for instance, is going to share their story. It would be under the FERPA exception. The one that is most often used for data sharing across C in 619 or C in EHDI or in longitudinal data systems is evaluation and audit. And that is one of the exceptions clearly listed under FERPA that allows you to share personally identifiable information, but you must have a data sharing agreement, and the data sharing agreement must meet the requirements in FERPA that are very clear what must be included. And at the end, we've got some resources that outline, for instance, what must be in the data sharing agreement. And of course, and other resources that you'll see in the end. And again, as I said before, make sure if you have any HIPAA implications in your state with your data sharing that you check with your privacy officer. So let's go a little bit further and talk specifically about Part C as a participating agency. And let's go ahead and just fill in that whole slide if you would. The relevant term that you're talking about in Part C, and we know all the Part C folks, of course, know this on the call, and this is a term used in Part B as well, is that you have participating agencies in Part C. And if you look at that second bullet, it's any individual, agency, entity, or institution that collects, maintains, or uses that personally identifiable information to implement a requirement in Part C. You can share personally identifiable information across participating agencies. You can only do it outside of that when you have parent consent, or, as you'll see in a minute, as an exception under FERPA. So as long as you're sticking within the group of participating agency folks, which include your lead agency, your early intervention programs, and any entity or individual that provides a Part C service. But this is important. It does not include, which is why it's relevant to the EHDI conversation, it does not include primary referral sources, or it does not include public or private entities that only fund Part C services, such as your Medicaid agency. So stick with that second and third bullet. It's the entities that provide services within Part C. So let's go a little further now. So if we want to share information outside of those participating agencies, like the EHDI program approaches you and they want to report, they have to report on what happens when they refer children to you, and they're looking for information on when the child was referred, were they found eligible, were they evaluated, and they may be looking for more data than that. They may ask you what services the child's receiving, what day the child exited from Part C. They may want child outcome information. But whatever the EHDI person wants, you can only give it to them as a Part C person, either with parental consent or under FERPA with the exceptions that we're going to talk about now. So FERPA does permit disclosure without parental consent. Now there's a list, if you go into the FERPA regs, there's a list of about 12 exceptions. And they relate to things like when staff or employees need access to perform duties. Monitoring comes to mind, things that you have to do to keep the program running, but that's internal people. When you're talking about external people, you have some exceptions. The only one we're going to talk about now is audit and eval. The federal office recommends that when we're talking about early childhood, we don't deal with the studies exception, that we use the audit and evaluation exception. And then you have some others, which, particularly the Uninterrupted Scholars Act, which deals with children who are residing in foster care. But for today, let's limit our purposes to audit and evaluation, which then requires a data sharing agreement. And we'll go to the next slide. And this is just a final reminder for you. So when you're approaching these conversations, you've got your two agencies, you're sitting down, you've decided you really want to do this because it's valuable to both programs, and we encourage you to think of the value to both programs. You want to think about where do those data reside, what data systems they're in, what agencies you're in. Thinking about what data elements do you really want to share, how you will share them, how you will make sure they are shared securely and carefully, and then stored as securely, and make sure that there's very careful access to who can actually see that data. And then there are other things that you'll look at in terms of how long you keep the data, what you do about destruction of the records. But the data, once it's shared, must be maintained and carefully, the security and access must be maintained when you receive the data. So there's lots and lots of important things to talk about and document in that agreement, which would be covered by what federal, state, and local laws would apply to your particular data sets. We're talking about IDE and FERPA. You will also probably be considering HIPAA, depending on the agency you're in, but you want to end up talking about what data sharing agreements need to be in place. Or if you're Georgia and you're within an agency, you'll talk about what kind of management plan you want to have in place and what requirements you want to cover. So we're hoping that, looks like there's lots of folks who are already engaged in conversations, lots of you are already sharing data. So the question is, are you doing it in a way that you feel you are protecting the data that you are sharing in order to make your program needs met? And I think with that, I'm going to turn it over to our state folks, and we are so pleased and grateful that I'm going to turn it over to our Arizona team.
Thank you, Sharon. Next slide, please. As Sharon said, my name is Annie Converse, or well, as she introduced our state, I'm from Arizona, and my name's Annie Converse. I'm the Part C data manager, and we're located within our Department of Economic Security, which is kind of unusual, but we're under the Division of Developmental Disabilities, like many of the other Part C programs. As part of state regulations, we have a 5-state agency intergovernmental agreement that lists the lead agency, the Department of Economic Security, under Part C. And the interesting thing is that that 5-state agency agreement said if you want to share data, you need a separate data sharing agreement. So that's where we started this whole thing. And co-presenting with me is Fran Altmeyer. She's with the newborn screening unit. She's a newborn screening manager with the Department of Health Services, where the EHDI program is housed.
Thanks, Annie. So as Annie said, I'm Fran. I'm with the newborn screening program, and that's where our EHDI system lives. And some of it, it's important to know, I see we have some EHDI coordinators on the call, but for the Part C folks, hearing screening is one of, in Arizona, 31 disorders that are on our screening panel, and I have a case management team. We provide follow-up to families for all of those conditions, including hearing loss, with the goals of having screenings completed by 1 month, enrollment, diagnosis by 3 months, and enrollment in early intervention by 6 months. And so that's been the focus of our work together. My background, I spent 18 years in early intervention before moving over to the Department of Health EHDI program 7 years ago. So that really helps having that joint perspective on the FERPA requirements, in addition to what we're striving to achieve in the 136 of the EHDI system. So our proximity physically, I'm on the north side of the Capitol, and Annie lives on the south side of the Capitol, so we're just a Capitol Mall away from each other. We have established our relationship to really understand what our roles are and our needs are, and that's been really important in establishing a willingness to work through our challenges together, understand what both needs are related to HIPAA and FERPA, and then our patience and persistence with each other as we learn of what we can and can't do under these FERPA evaluation and audit exceptions. Some of our challenges have been our different data systems. Like Sharon mentioned at the beginning, early intervention has their own homegrown iTeam system. In the EHDI system, we use a commercial system called HindTrack, which documents all of our hearing screening, diagnosis, and intervention data. We both have differing records retention schedules, and of course, under newborn screening, we fall under HIPAA, and under Part C, they fall under FERPA. There are also some hybrid entities in there as well. Next slide. So some of the reasons for our data sharing, of course, to improve federal reporting for both programs. That's, an important evaluation piece. For EHDI, we report to the Centers for Disease Control, and for FERPA, they report to the Child Find. So we want to make sure that we're identifying all these children, both timely and appropriately. Hearing screenings are required to be reported for any child under 2 in Arizona. So our data sharing agreement will help us ensure that children are being screened and their results reported. The Part C program does provide OAE screening equipment to their contracted teams, and they want to be able to make sure that children are being screened appropriately and that the equipment is being used. Analysis of Child Find activities. Did we catch all the kids that are diagnosed as deaf of hard of hearing? We missed a few last year. Since our data sharing agreement was completed not long ago. Annie and I had the opportunity to sit down and really crosswalk these children, and we can see where there are gaps. And their next step will be to evaluate who do we need to target some interventions on to primary referral sources. And then answering critical questions like, are we making a difference? That's what we're all in it for, is to make sure that these children that are identified early receive appropriate and timely services to make a difference. Annie?
So we've been able to get this far due to the technical assistance we received. We've been fortunate that we applied and received intensive TA support. Our TA providers have pointed us towards and helped facilitate the use of various tools and resources that we've used on this project and other projects. So we've been able to apply the lessons learned through our various work, but we've looked at their critical questions document. We've looked at the data sharing checklist to help us structure our approach. They helped facilitate a review of our draft data sharing agreement with the Privacy Technical Assistance Center, which helped give us a little bit of some of the necessary momentum we needed with our internal privacy officer. It's taken us approximately 2 years to get where we are, with the majority of the work, I would say, within the last 6 to 7 months. And quite a bit of time was spent, I think, in the beginning trying to get me on board and help me understand the FERPA requirements, because I initially thought FERPA prevented me from disclosing the data with another agency, period. So our TA providers helped us to understand and follow the FERPA requirements. Like Sharon said, we did use the FERPA exception for audit and evaluation. And we really learned that FERPA does not prevent us from sharing or disclosing the information. It just states that it needs to be done in certain ways. So all along the process, they've been able to help us, give us those regular meetings to hold us accountable. They've been our cheerleaders to help make sure that we can cross the finish line. And so if you could move to the next slide, please. So as part of our data sharing agreement, we did have to specify the data elements that we wanted to share. We wanted to capture, the state law in Arizona requires us to provide the information on enrollment data. So we specified that we wanted the referral and the IFSP dates. There were some slight differences that we had to work through to ensure our data aligns. One agency called it a date of birth, the other one called it a birth date. And so just ensuring that the data elements that we wanted had, we both had the same understanding of what those data elements were. We explored using the same unique identifier, but it wasn't possible in our data system, in the Part C data system. So we learned through the TA that we received about other methods for matching the data. So because each of our agencies has a unique identifier, we just report back using both identifiers. We're currently working on automating the match process. Right now we're capturing it manually and sharing it manually. This helps us so that we can kind of see what it might look like when it's automated and help us go through that. And it helps us link the data at a child level so that we can provide those reports and evaluate the process. The thing that's really nice, we've specified in our data sharing agreement all the data elements. So we're able to refer back to that to know what can and can't be shared at the child level, and it helps us maintain and respect the privacy of the family. It's helped us to develop an understanding between both programs about what can and cannot be shared. So if the data sharing agreement does, we keep looking back at the data sharing agreement. Does it say we can do that? If it does, then we do. If it doesn't, then it helps because there's no hard feelings. We know we can't do it because it's not spelled out in the data sharing agreement at the child level. So that might be something we have to look at on an aggregate level if it's really needed. So if you'll move to the next slide for me, please. I just wanted to give a quick before and after picture. On the left, we started with the manual consent for each child that our Department of Health Services was requesting, and there, because of the mobile nature of families in Arizona, some of them move, some of them don't want their information to be shared. It was creating some gaps. So on the left, we have the individual consent that we started with. And what we learned was it was not even part of our actual document library. So it was kind of a form that not everybody knew about, only a few people knew about. So as part of a temporary stopgap to try to ensure that we are sharing the information we're required to share, we did formalize the document and put it officially in our forms library. And then on the right is the cover page of our data sharing agreement. So it's kind of a before and after picture. We were sharing individual consents at the child level, and then now with our data sharing agreement, we have that formal FERPA exception written up for audit and evaluation. And if you'll go to the next slide, please. So we completed our data sharing agreement in late July 2019. It's still hot off the presses. The data linking is helping us already provide complete data to our Department of Health Services EHDI program. The knowledge about the group of children's referrals is increasing every single time we share data. So our EHDI partners can now see how many children were referred and how many declined services, how many moved forward to IFSPs. And before, some of that was just unknown because we didn't have those releases at the child level. So I wasn't able to share it one way or another. The EHDI program didn't know what happened, but in Part C, I knew that the children were referred and they were exited and what reason they were exited. We did discover that some children were not in the Part C database, so we've been following up with our local early intervention programs to get a better understanding and improve our child find activities. We learned that through this several-year process, we learned that the EHDI program wasn't mentioned in our policies at all, even though it's a requirement for our local early intervention programs to share information on the hearing screenings that they're completing with those OAEs that our agency is providing. And there was just a general misunderstanding of the policy as it relates to what is required to be shared and when. So I think the most valuable lesson I learned too, I was a new data manager when this started, when we started this process, and this TA that we received really helped me become better at my job. I'm more comfortable with data sharing agreements in general and with safeguarding the data and knowing that that's a key part of my job. I've been able to turn around other data sharing agreements when we had a contract change with our local early intervention program very quickly because it provided a template for me. And overall, it was just a very positive process, and I wish we would have started it sooner because the information we gathered was so valuable for evaluating our system. So I would recommend to other programs, don't hesitate to get TA. Get TA if you need it, get it early and often. Our TA providers were a neutral third party that just helped us facilitate the conversations, and they've been amazing. So with next steps, we are working on automating our data linking, and I'm really excited about that next phase, thanks to the cooperative agreement that we have with the CDC and with our Department of Health Services EHDI program. And we really want to keep working on larger projects with our Part B counterparts and really getting better data linking on transition and longitudinal data to answer some of those really big questions within our system. We're working with our Interagency Coordinating Council to update our Parents' Rights booklet with new phrasing on how data is shared across programs. And, you know, it's just exciting to be able to use the information that we're getting to improve our child find activities. Once we have a little bit more data in the system, we'll be able to look at program efficacy and child outcomes. We'll be able to assess for compliance with the state law. We'll be able to better meet our child find targets. So I'm really excited for the next steps with our data sharing agreement. And Fran, I don't know if there are any other.
No, I think you summed it up. I think our automation is our next big exciting step. We had a meeting today even to continue with our IT people so that we can make sure our languages understand each other so that we can not have to manually meet and look up the information, but that it'll automatically be pulled and pushed into the respective data system. So yeah, very cool things on the horizon.
Thank you so much to the Arizona team. We really appreciate it. I know folks have questions, but we're hoping you could put them in the chat or hold on to them because we want to, in the interest of time, we'd like to hear the Georgia story first, and then we'll save some time at the end. So thanks very much, Arizona. We really appreciate it. And here's the Georgia team.
Hey, good afternoon. My name is Judith Carr, and I'm the Child Health Screening Senior Manager at the Georgia Department of Public Health. And I'm joined today by my colleagues, Dr. Brent Culpepper, who is our EHDI team lead at the department, and Lisa Pennington, who's the Deputy Director of Early Intervention here at DPH. And we're going to talk a little bit about our experience with our data sharing partnerships. Thank you. So within the Georgia Department of Public Health, EHDI and Part C are co-located. The department has two divisions, the Division of Health Protection and the Division of Health Promotion. Health Promotion has maternal and child health as a section, and within maternal and child health, we have a unit that contains our EHDI program and a unit that contains our Part C program. The unit supervisors for Part C and for EHDI are Lisa and myself respectively, and we each report to the maternal and child health director. So in effect, within the department, EHDI and Part C share the same leadership structure. Next slide. So from the EHDI perspective, the request to share data emerged from the annual process that the EHDI program undergoes to review our goals and our strategies that we have in place to meet our goals. And through that process, it became pretty apparent that we needed to establish a data sharing agreement with our Part C partners. And that's because in reviewing our 136 benchmarks that Arizona mentioned, we determined that we have a mechanism in place to evaluate the extent to which our infants were screened by 1 month, and that's through reporting from birthing facilities in our pediatric offices. We have a mechanism also in place to evaluate the extent to which infants are receiving diagnostic evaluations by 3 months, because in our state, our law is that if children under 5 are identified as deaf or hard of hearing, then that has to be reported to the Department of Public Health. But what we didn't have at the time in place was a mechanism to consistently evaluate the extent to which we were not only referring, but enrolling infants into early intervention. So that would be that 6-month milestone. So in wanting to have a very complete picture of how we were doing on our 136 milestones, we needed complete data. So like a lot of other states and territories, our EHDI program submits an annual report to CDC on our 136 performance and some other indicators annually. But we're also an expanded state, and we have an agreement with CDC to submit additional reports throughout the year. So data completeness again becomes a big goal to meet our reporting and evaluation requirements. We also looked at our EHDI functional standards, and the functional standards are criteria that EHDI programs can use to evaluate their EHDI information systems or their EHDI databases to see how they match up with the program. So we wanted to make sure that our database and our functional standards really reflected the efforts of our EHDI program. So by having a more complete picture of how well we were meeting our 136 milestones, we can assess whether we're making an impact, and we can also identify areas where we can improve. So evaluation and reporting really are 2 main drivers. At the time, this was about 2017 when we started our process, our EHDI coordinator learned about PTAC and the Technical Assistance Center and reached out in conjunction with our Part C coordinator for some support in developing a data sharing agreement between our EHDI and Part C programs. And in that process, we, like Arizona, received a lot of support and technical assistance. And working with the TA Center was really a pivotal step for us. We talked in the past about sharing data, but we really didn't know how to move forward. So having that expertise kind of at our fingertips was very helpful. One thing that we got to do by working with the Technical Assistance Center was look at some other states' data sharing agreements and looking at the elements that they had and aligning ourselves with the technical assistance that we received. We pulled out all of those essential components to a data sharing agreement and included it in the one that we have now in our state. So some of those essential pieces are the purpose. So we had kind of the purpose and the rationale for why the EHDI program and why Part C wants to participate in a data sharing agreement, talking about the outcomes that we wanted to evaluate, and the function of our system that we wanted to evaluate. We also delineated kind of the scope of work for EHDI and the Part C program, delineated the responsibilities of each program. We were specific about the frequency of data sharing, and we also included the actual variables that would be shared. So in the next slide, we have a list of the variables that are available to the EHDI program from Part C, and these look very similar to what you saw from Arizona. And in our experience as well, we had to make sure that the variables that we had in the EHDI program crosswalked and matched the variables that were available through Part C. So we had to come up with some common definitions to make sure that we were talking about the same things. So we also came up with this list by kind of looking back at the purpose and the scope of the data sharing agreement. We want to make sure that we're evaluating our system and we're doing that responsibly and that we are able to be compliant with our reporting requirements. So we generated this list of variables based on our CDC data reporting requirements. So we wanted to stay really, really in scope with every step that we took in this process. Next slide. So some challenges to executing our data sharing agreement was the data entry process across our programs. So EHDI provides Part C with a list of children identified as deaf or hard of hearing. And the Part C data manager will use that list to query the database, the Part C database, to find those variables that we showed in the previous slide for each child. However, if the data are not entered in the database to match the way the query was written, the data would not be included in the report. And our Part C data manager and the Part C evaluator would have to go in and kind of data mine by hand the children that we knew had been identified as deaf or hard of hearing but didn't have information returned on the query. We also were in a similar situation when we looked at primary eligibility for participation in Part C. Being deaf or hard of hearing was not always listed as a primary eligibility. So that also inhibited children being returned, our data being returned on the query. Another challenge, or I guess a solution that the EHDI program came up with, or we thought we came up with to address this challenge because we didn't want this process to be cumbersome on the Part C program, was that we thought it would be more efficient if the EHDI program could just have direct access into the Part C database and we could just pull out the variables and the indicators that we needed. And that was, we quickly learned that that was not appropriate and not the best way to move forward. So we are receiving reports instead of having direct access to the database. And at the time we perceived that maybe that to be a challenge, but that's actually turned out to be for the best, and the EHDI program is just fine with that. Another item that unfolded as we were going through this process that wasn't really a challenge, but again, it helped us to make sure that we stayed within scope, and it helped us kind of in the overall process at the end was reminding ourselves for the reason why we were sharing data. So as we were jointly brainstorming and thinking about all of the possibilities and all of the kind of information we could gather and all of the things that we could look at with the data sharing agreement in place, we had to always remind ourselves that the purpose and the scope for executing an agreement in the first place. And that really helped us to stay within boundaries that allowed our program to evaluate our performance, but also respected the family and their privacy. Having kind of that reset and revisiting the purpose and the scope was also helpful internally for EHDI and Part C, but it was also helpful when we were communicating with our TA partners and really communicating with them on what it was that we were looking to do and some of what our goals were. So being clear on your goals, being clear on your scope and what it is that you want to do within the boundaries of your partnership is important. So that's an important reset to revisit often. But the way that kind of operationalized was we ended up having a lot of conversations between our programs, and we ended up making a lot of revisions to the agreement that we now have in place. But all in all, that process served us very well in the end. Some lessons learned through this process is that buy-in from each program is important. So as I said earlier, the EHDI program and the EHDI coordinator and the Part C coordinator endeavored into this process jointly from the very beginning. We worked very collaboratively as a team. We made revisions to the agreement. We met, we emailed them around, we participated on calls together with the Technical Assistance Center. And that cross-programmatic engagement helped us to sustain the project through the initial conversations to implementing the agreement and then ramping up to next steps. Also a note that buy-in at the national level from Part C, 1 second. Another note is that kind of to that cross-programmatic engagement, buy-in not only locally between the programs that are looking to work together, but national buy-in was also important and helped to facilitate this process. So the EHDI team received direct and ongoing technical assistance from the PTAC Center, which typically assists Part C programs. And again, having data sharing agreements in place with CDC and having these reporting requirements, that synergy across programs nationally helped with the synergy across our programs here locally. So cross-programmatic buy-in is important at all levels. And another lesson, I kind of talked about this a little bit over and over again, but another important lesson we learned is that focus on what you can do. So we came up with some really big ideas, but really being honest with what the purpose and the scope is and staying true to that purpose and scope helps to make sure that you're moving within a boundary that's permissible and you don't have any unintended consequences or any unintended creep from what is permissible within your partnership. So our next steps, next slide, are to receive data more frequently. So when we first executed our agreement, we were receiving data maybe annually, and then we went up to twice a year to report our expanded data, to submit our expanded data reports twice a year, and we want to move to quarterly data reports next. Quarterly data reports will be very helpful, especially as we continue to strengthen our query and strengthen to the process that we use to pull information out of the Part C database. So if there is any manual activity that needs to occur by the Part C data manager, she is working on a smaller data set through quarterly data pulls. We also want to explore storing data in the EHDI database, which kind of links to the next bullet, which is automation. We are wanting to come up with a really nice process to automate variables from the query that's pulled the CSV file into our EHDI database, so that process can be mechanized and we can have the least amount of human interaction as possible. And also that would really help us with our evaluation piece in the EHDI program, looking at our functional standards and the extent to which this Part C data is housed within our database. And it will also help us with ongoing evaluation efforts. And that's all we have. So thank you so much. And again, I did most of the talking for this piece of the webinar, but Lisa Pennington and Brant Culpepper, our early intervention and our early hearing detection and intervention folks, were integral in this process as well.
Thank you so much. Lisa or Brant, did you want to add anything as we move over to questions and discussion?
No, thanks, Sharon. I think Judith covered everything. She did an excellent job. It was a process. I actually came in on the tail end when our Part C coordinator left the program. So most of the work was done. So it was a good opportunity for me to get to know the EHDI program in Georgia here. But no, I don't have anything to add. Thanks.
Thank you, Lisa. So I'm going to turn it